All right, what's up, everybody? It's your host, Brian Purnell. I'm back here with the 3Sixty5Podcast. Today I have a very special guest with me, Dr. Cynthia Woods. Appreciate you for coming on the show today.
Thank you for having me. It's my pleasure.
So for everybody who doesn't know, Dr. Cynthia Woods is a psychotherapist and a licensed professional clinical counselor. I really want to start off today just by letting everybody know what it is that you do and give us a little bit of background about that.
Okay, great. Well, I am a psychotherapist, as you mentioned. I counsel individuals dealing with behavioral health, so that's mental health and emotional health, and maybe in some substance use disorders. So I've been doing this for about a little over 17 years now. I enjoy what I do because I like helping people. I like helping them to know that what they're experiencing, there's help for that, not to feel embarrassed or anything, to ask for help, and to be able to learn some new coping strategies to help them to work through the problems that they're experiencing.
And so how long have you, I know we talked about this, you've been doing this for about 17 years?
Yes.
And what got you started into that? What made you
Wanting to help people on a much deeper level. I've always been in the area of working with individuals from real estate, started out in business as well, but wanting to be able to help people on a much deeper level that will impact their lives. And this is one field that I feel, in my opinion, is one of the most important fields to be able to do that.
And for people in my age group that are watching, I know a lot of us, we spend a lot of time to ourselves and things of that nature. And do you believe that it's healthy to spend a good amount of time by yourself? Because I know you can get lost in your thoughts, and some people like being alone. So what are your take on that?
Well, it's very common. It's very common in spending time alone. The College Health Association did a survey showing that there is 64% of females and 57% of males that spend time alone in isolation. There's a balance that needs to take place regarding that, because you want to make sure that you're not totally removing yourself from interactions with others, because we are designed for relationships. Right? And so we want to make sure that we're interacting. So total isolation is not healthy, because then you tend to not want to reach out to others. You gravitate more to online things such as gaming or social media or Netflix. So those things that require you to move away from others, and then you lose the balance and it becomes unhealthy.
Right. And so talking about college students, I know for me, like myself, I'm a college athlete, and I believe that if I wasn't in a sport, it would be a lot harder for me to make friends because I'm not as social. So what would you recommend for those people who might not be in sports or a club to do for themselves? Because it's so hard just to go up to somebody and say, hey, or start that conversation. What would you recommend for people who might feel alone in that regard?
And I'm glad you brought that up, because starting college life, that's a new transition, right? We have families and relationships of friends that we fostered over the years, and now we're leaving high school and home, and we're coming here in a totally new environment, right? So in that aspect of things, just recognize, first of all, just being able to identify the self-awareness is key. Self-awareness is that, I'm really having a tough time here. I want to make friends, but I'm experiencing some barriers that's keeping me from doing that. And so making that, helping yourself with that awareness, then you want to do some simple things. When you're in class, when you're going to your classes, try to take small goals, set small goals. Say hello to someone new in each class that you go to. Just say hi. Or even look to see if you can make a study partner. Form study partner. Or simply go to some structured groups on campus. Structured by, I mean, like if there's a speaker coming and you, for any class assignment or even for your own personal edification, to go to listen to that speaker, because then that takes the pressure off of you of having to socialize to meet a friend. You're going there to hear that speaker, or you're going there to learn more information about that particular event, that co-op group that's taking place. So things like that, and will help you to get out more, or even seeking out a local church in the area, going for a church group social get
Right.
into, interacting there, because you find a lot of different supports in different areas, and not being so hard on yourself.
That's
Not putting
huge.
so much pressure on yourself that I have to make these friends and I'm the only one that doesn't have a friend. And that's so misleading, because there are other individuals that feel just like you do that aren't able to reach out and make friends. So that person that you see sitting by themselves, just walk up and say, "Hi, my name is Cynthia. How are you?"
And I believe that's probably the biggest misconception of being in college, that you have so many friends and there's so much to do. And sometimes, like with me myself, I'm at a smaller school, so it's definitely a lot harder to reach out to people, because everybody has their smaller groups and things of that nature. But I think maybe even movies and stuff kind of play that role of the perception of college life and how fun it is. But sometimes you're alone most of the time, whether it's studying and you've had a hard day and there might not be as people to talk to as you're further away from home and things of that nature.
Yeah, and that's very true. And even though you're studying as your first priority, you still want to engage in activities, like yourself. You're engaged in sports. So you want to engage in activities or groups, because research shows that when you are engaging in activities as well as studies, you're more successful in your study life, because you have a balance. You're not all just focused on learning, but you're also learning how to socialize with others. Once you engage in something that you enjoy, or just trying it out for curiosity's sake, then you are tending to socialization occurs, and it happens naturally, because that's how we're designed.
Right, and I think that definitely makes it a lot easier for you. Like you were saying, it takes the pressure off your shoulders. There was a guy on a podcast, I can't remember his name, but he said your mind has to be stronger than your feelings. And I wanted to ask you, do you believe that most mental health problems are mental health problems or emotional health problems? Because I think that there's a slight difference.
There's definitely a difference. The name is used interchangeably, mental health and emotional health. But there's a distinct difference, because mental health, I like to let's look at it in terms of thinking versus expressing.
All right.
So mental health is the way you process things, your thoughts, what we call your cognitions, is how you're processing. Your emotional health is your feelings. It's the way you're expressing your feelings. And they tag team together. So if you have an imbalance in one, then you're not going to get an appropriate response. So your feelings, as you are expressing them, if you're having anything that's throwing them off, for instance, if you are experiencing any depression or anxiety, now that's the imbalance that's going to take place, that's going to interact and affect your thought process, because you're dealing with something that's causing the difference to occur.
Correct.
So they interact, they balance each other out. However, they are two distinct entities.
And do you believe that social media plays an effect? Because today there's so many different apps and social sites, especially for people who might compare themselves to others through social media, and that creates a snowball effect for you. Do you think that definitely plays an effect, especially in my generation?
Most definitely, because on social media, it was designed, right, for connectedness, that we can always stay connected with someone. But if you don't have that many friends, who are you connecting with? Right? And then the other thing of that is you're only seeing a snippet of that person's best moment.
Right.
They're showing you what they want you to see, whether it's the most fun they've had, most excitement they've had, how elegant they may be, or the activity, the sport that they're participating in. And then that causes that person who's isolating themselves to feel even more alone, and to feel as though, wow, their life is so perfect and mine isn't. So all they get to see is what the highlights of the person's life, and they can't relate to that, because they feel that they have this low thought process of, woe is me, that's not happening in my life. And then that tends to make them withdraw even more. Right.
And so I think that there's a huge negative stigma around therapy only being for sad people, or like, what are some other misconceptions that people might have that you would shed light on?
Well, the biggest one is that I hear all the time, and I try to reassure people, is that, no, you're not crazy. That's the first thing I hear. I'm crazy. I don't want people to think that I'm crazy because I'm having these thoughts that nobody else has. No, you're very normal.
Right.
You're very normal. We all experience stress in our lives, and that's what the emotional part is, not being able to manage the stress, dealing with relationships, how we view ourselves. And so we're very normal. So being able to move away from the stereotype of that we can just get better on our own, or pull our own selves up with our own bootstraps, or you can get over that. That's not a big deal. We're here to help. The professionals, counselors, therapists, the name is interchangeable, psychologists, we're here to help. We're here to help you to deal with whatever pressures are going on in your life right now. Because sometimes, as you stated, being on campus and not having the friends, and then the pressure of the academics, making sure your grades are intact, can cause one to feel emotionally overwhelmed.
Right.
And you don't have to wait until it's a serious situation. You don't have to wait until it's anxiety or depression. You can be proactive, because being able to recognize what's different, right? Noticing that you're starting to feel more tired than usual, or it's hard for you to concentrate and focus.
Right.
Noticing that you may start to get a little teary-eyed. Certain things you kind of feel like I'm being more sensitive than I normally am.
Right.
So being aware of those things about yourself. And then it's okay to reach out on your campus, because most campuses have a counseling center or workshops or groups that you can come together with other students who are experiencing the same challenges, the same social difficulties that you may be experiencing.
And touching on that anxiety and depression, is it wrong to self-diagnose yourself? Because I know so many people I have anxiety, but they've never seen someone about that, or I have depression, but they don't really. Is it wrong to self-diagnose, or do you need to come to someone?
Well, I think you should speak with a professional to make sure that is exactly what you're doing. Because yes, we do that all the time. We go on the internet, we look up all signs and symptoms, and we say, "Oh, that's me. I got that." It could be, and then again, it could not be. Okay. There's mild depression, and anxiety is simply stress or worry about a situation. Sometimes it just needs help in developing some positive coping strategies, opposed to doing what we call self-medicating, turning to drugs and alcohol.
Right.
So just looking at things from a different lens. And just, again, self-awareness is key. I'm not functioning the way that I should be functioning. Let me get some help. Let me talk to my parents. Keep an open dialogue with your parents. Talk to the professionals on campus, some of your professors or coaches, and let them refer you to the counseling staff. Again, the pastors at church, interacting with people at church and sharing how you're feeling. It's good to have many supports around you to help you to be able to kind of sort through what's happening. It's just like physical health, right? If you're not feeling well physically, what do? You go to the doctor. You go to see someone who can understand your symptoms to help diagnose what's taking place. Right. Same thing with mental health. It's mental wellness. It's not saying you have an illness. You're saying you want to be well emotionally, behaviorally, and psychologically.
Exactly. You want to check all those boxes.
Exactly. Well-being.
And what are some anxiety symptoms that people might have that they could not be aware of? Like, I know you're saying some people go online or they check the symptoms and things like that, but what are some common things that go unnoticed?
Well, anxiety is simply when one is dealing with a lot of stress, or they tend to worry a lot, or they feel anxious about situations where they cause themselves to feel as though it's hard for them to make a decision, or they always need to know the answers to something. It's difficult to proceed forward without having the final outcome, needing to know the outcomes of everything. So, but you want to look at it in terms of, is it causing me damage in my daily functioning? if it's impacting you in a negative way in your daily functioning, then that's when you want to talk to someone. Worry, it's normal. That's one of our emotions. Worry, fear, happy, sad. Those are some normal emotions. But you want to do your checks and balances. When things start to cause to impact you negatively, again, in your daily functioning, then that's when you want to talk to someone.
And what's your take on unsolicited advice, just from whether it may be friends, because some people might not be as comfortable right now at this point in their life with going to a therapist or something like that. But I know, like, unsolicited advice, you talking to someone, do you just need that person to listen to you? Or I'm not always sure how to phrase that, but what is your take on unsolicited advice from other people that might not have that expertise background like yourself?
Well, with anything, sometimes you have to take with a grain of salt, right? You're careful on who you're getting advice from. You want to make sure if it's someone that you can trust, that they've shown up for you in situations. Or if you're just comparing, and your peers, in this age group, we're all tend to kind of communicate and share life experiences. Or this is what I had, or this is what my sister had. So you got that too. So, that's you're bipolar. You hear that a lot, right? Because your emotions go up and down, things like that. It's like with anything, you don't want to always depend on somebody else's opinion on you, just like you wouldn't take somebody else's medication.
Right.
You go and get your own diagnosis. You go and get your own medication. Now, if someone is saying they see some things in you that they feel concerned about, they notice that you're always, you're sleeping a lot. They notice that you're kind of isolating and you're staying away from everyone. When people, express concerns and bring up things that they see in your behavior has changed, then yes, you want to pay attention to that. But if they're just saying, "Oh, my sister got that. That's what you have," that's not an accurate diagnosis, and you want to explore that more.
I know earlier we touched on just a little bit the coping, like different ways of coping, and I wanted to ask you, how helpful do you believe is crying? Because I know for so many guys, we're always taught to tough it out and stick it up and do it yourself. Do you think that everybody should cry, or is it different for everyone, especially with men sometimes not being able to show that emotion because they might think that they're weak or whatever that is?
Our society places that on us about men not being able to show their emotions, but crying is just simply a way of showing how that situation truly impacted you deeply. So tears they give you a chance to express genuinely what's going on inside. People have been known to have happy tears, as because they're so excited about something. But research also says that there's something underlying there that maybe have repressed, that they're maybe causing them to cry. But then again, people cry because they're angry or because they're sad. Releasing how something has touched them deeply.
Right.
And crying helps us. It's a release also. Once depending on how deep the situation was, the tears help you to release that pent up frustration or pain or fear, whatever's going on internally, and you can get a release after that. From letting go. Now teardrops are only for one thing. God has given us for only one thing, for crying, and we're to use them. And I don't think we should, allow society to dictate what that represents. Now, yes, we're going to control our emotions, in different settings, but if you feel that you can't cry, you're in a public setting, but maybe take the time out to revisit that later privately.
Yeah, I know, because for me growing up, that was, like you said, society putting that on us. Like I would never cry. Like, even when I knew that I needed to let something out, I would do whatever I needed to do to get away from that. So I know so many other guys that may be watching have felt the same way. But I think it's changing now, just with there being more mental health awareness now. So it's bigger for people to talk about. People are a lot more open about it now, than they were in the past, which I think is great and I think is healthy. So I feel like we're in a society, we're moving in the right direction right now.
It is, because you just don't want to continue to shove down those feelings. Because if you're just shoving them in and pushing them down, eventually they're going to come out in some other way. Anger, irritability.
Right.
That's why people tend to start to self-medicate, with drugs and alcohol. Expressing how you feel, people are, they're trying to be more open to that, especially for men, being more open to that. But that's just a natural way that we, God has made us to express our feelings. And we should do it. We shouldn't try to shy away from that.
Right.
Yes, there's always circumstances that dictate everything, but we should always be able to revisit that.
And so you've been doing this for a long time, and just before we close out the show, I want to know, what are 3 things that you would recommend not doing because it's bad for your mental health? Because I know we sometimes we think, oh, this is good for me, but it's really hurting you in the long run. Well,
think 3 things to not do. One would be to totally isolate yourself. Because when you isolate, you remove yourself away from all the supports and the help that you can get. And the love. Believe it or not, there is a lot of love that others have to give you. And in our day and age, there's just too many suicides happening.
Right.
And that's because when a person feels that they have lost hope, that's when they are isolated. And then that's when they allow things to become distorted in their thoughts.
Right.
So I would say not to isolate yourself, because then you remove yourself from the love of others, the help of others, and the support of others. The other thing I would say not to do is to not self-medicate, meaning the drugs and the alcohol, which is becoming very prevalent now and with our age group, your age group. Because also that clouds the way you think. You aren't able to think clearly. You're not able to be your true, genuine self, the athlete, the intelligent person, the scholar. You're not able to do that when your mind is clouded, and you go down this debilitating cycle, because not only now are the drugs, and I'm not pro-drug at all, but I just want to say this for those who use it, not only are the drugs, they're tainted. Right. With fentanyl now, which will cause great harm to the body and even death.
It's just been a lot of rising cases with that, I've seen.
Exactly. It's just a higher risk now than ever before. You don't know what you're getting. So that's the second thing I would say. And I would say not to, what my third one would be is to not to allow anything in your life to be more important than God, than your relationship with Christ.
Right.
That's what I would say. I would say hold on to your faith and trust God, because He has allowed you to be where you are in your life right now. Yes, we've all made mistakes.
Exactly.
But we can all be forgiven and move forward and have a much better life. You can't have a better life than what you're already having without Christ.
Exactly. Well, I appreciate you for coming on the show and taking the time to talk with me today about mental health. And everybody, make sure you stay tuned next week for episode 7.